All right. Well, welcome to the webinar and thank you for joining. We are going to be talking today about exploring the link between healthcare strategy and experience of care. My name is Christine Wolf, and I'm the Chief Clinical Officer at Ovation Healthcare. I'm a nurse by education. There's some information about me here. I will share with you that I lovingly say that I've done many things from the bedside to the boardroom and truly love working at Ovation Healthcare and taking on about almost 30 years of clinical experience and putting that together with my teammates and my colleagues that are here with us today and really supporting our clients across the country. I am a doctorate prepared nurse and I am board certified as a nurse executive advanced professional through the ANCC, and I'm also a Leapfrog certified coach. I do want to share with you a little bit about our organization, Ovation Healthcare. You will see we have different lines of business to be able to support clients in the space of supply chain, revenue cycle, Octave, which is where myself and my teammates on the call today sit. We are able to provide leadership, advisement, strategy, clinical services, many things. And we'll talk a little bit about some of that today. And when we think about strategy and patient experience, and then also our organization supports things in the IT space as well. We serve throughout these many spaces and are true to our operating principles to really be able to serve our clients, keeping healthcare local. Many things that we are able to do across the country. We are in 47 states across the country, have nearly 400 clients, and really looking at some of the things to be able to support our clients in the space of shared services, creating revenue, preparing for technology beyond that electronic health record, supporting in the area of policy, and also what we're very passionate about too is developing the next generation of hospital leadership. Very passionate about that. You'll probably hear that come through. This is just a little bit of a roadmap about where we are, as I mentioned, in 47 states across the country and continue to grow and over 400 clients at this point. So some of the challenges that we're going to, talk about, what some of the things that we struggle with, I think, as healthcare across the country. This is not new or unique. I'm sure that many of you all feel this way too, but we see this in urban, rural, small, large, everything across the board. And it's really things that I think that we can all come together on. And we're going to talk about some of that today. This is just one of the examples, given the challenging landscape I think that we all face today, that we can come together, but really look at, what are our opportunities from the operational perspective to the finance to the regulatory and so forth. So we're excited to get into this in a little bit more detail. So, this is also just a little bit of a point that we want to take a pause on and really recognize obviously the connections, right? So where the research has shown that there's positive clinical connection to experience of care. I know these won't be new to any of you likely, but really just to pause and to call it out. And we just want to make that connection. So thinking about, what happens with those patient safety indicators and how do we put those into practice? How do we utilize that? How are we utilizing our patient reports, events that are happening? How do we take that information and really make that connection about how we're providing care across the country, our clinical care? How does the technical piece fit into that as well? And how can we utilize some of those the technical pieces of things to help us improve our work? How do we associate that with communication, whether it be with our patients and families, with our from our providers and so forth? So lots of opportunity here. Just wanted to make that little bit of a connection, and we're going to get into it here a little bit more. So I want to share with you a little bit about our facilitators today. I'm joined by my colleagues, Riley Griffin, as well as Gina Lehman. Riley is so passionate about keeping healthcare local. He works directly with client organizations to identify opportunities for both that growth and development. You're going to hear about his strategic background as it comes through in our discussion today. In Riley's previous role, he served at a community hospital in Central Texas. He gained valuable experience with that strategic planning, as well as market analysis and process improvement. Riley's one of our consultants, and he combines that well-developed analytic skill set, which I think is really important and needed to balance out all of this work, and has that fresh strategic approach and perspective to help our organizations achieve that long-term success and viability. So please join me in welcoming Riley to the webinar. And also, we are joined by Gina Lehman. Gina has over 25 years of healthcare experience and clinical leadership advisory roles, and certainly possesses a strong background in strategic organizational development, program and process improvement, operational oversight, and her true passion is really about the patient experience. And she's consulted in this space before, also is a certified patient experience professional. She's very passionate, and you're going to see this today as well, about the integration of quality, safety, and those experience elements about patient care delivery. She has been a trusted partner with various organizations to positively impact the performance and achieve those sustainable results in such a nice, coordinated, and strategic approach. Gina has presented many times nationally, regionally at conferences on the patient experience topics and how we can really impact that. She has done many things in the virtual and in-person space to provide education to thousands of people and clients across the country. So please join me in welcoming Gina also to the webinar. Our learning objectives for today. So we hope that after attending the webinar, that you will all be able to discuss the connection between an organization's experience of care and quality and safety outcomes, discuss the business case for aligning an organization's experience of care with that overall strategic direction, and lastly, identify at least one best practice for integrating experience of care into organizational strategic planning efforts.
Great. Well, Chris, thanks for that introduction. And thanks to everybody on the call. We appreciate you guys spending some time with us this afternoon. Wanted to just quickly roll through our agenda, some of the topics we'll be talking about today. So we'll start off by just introducing, what is strategy and what do we mean by experience of care? We'll talk about why we're talking about them together today and what that link is really. And that'll take us into some practical steps for how do we do that? How do we start to integrate these two disciplines into one collaborative approach? And then we'll round out our time together talking about a little bit about what leadership's role is in really instilling a patient-centered culture throughout the organization. And then we'll leave you guys just with some key takeaways from the presentation today. So to start off, what even is strategy? So I think if you asked probably 1,000 different strategic planning professionals, you probably would get about 1,000 different definitions of what strategy is. I'm not here to say that any of those definitions are wrong or one is better than any others, but the definition that we've landed on here at Ovation that really serves us well is this. So a good strategy provides a clear roadmap consisting of a set of guiding priorities that defines the actions people in the business should take and not take, and the things they should prioritize or maybe not prioritize to achieve desired goals and navigate the future. So I know that that's a pretty wordy definition just to pull out of your back pocket at any one moment. So I think it's important that we just focus on what's highlighted in blue here. So at its core, a good strategy provides a clear roadmap, consists of guiding priorities that helps you navigate the future. So what does that mean really in practice? It's important that we understand what strategy is and can define it, but I think it's also important that we understand what strategy is not, right? So just a couple considerations here. A plan in and of itself is not necessarily a strategy. So a plan can be very operational, very in the weeds, very day-to-day in nature. So it's important to delineate that a plan, just because you have a plan doesn't necessarily mean that you have a strategy. Similarly, it's not the actions that you take day to day. So a good strategy, strategic thinking really involves stepping out of your day to day, task lists and really looking at the organization at large and starting to plan, on a more proactive basis. And then finally, a strategy evolves. It should be malleable to some degree as the market conditions that you're operating in continue to evolve at a fast pace. You want to make sure that we're constructing a strategy that is malleable and can evolve as those conditions evolve as well. So all of these considerations really help us to start to think strategically. So what that really entails is staying alert to what's going on in our industry currently. So understanding our consumer preferences, understanding the preferences of the consumers and the patients that we serve, but also understanding what are our competitors doing? How do we match what they're doing? How do we win in the environment that we're competing in? Like I said earlier, it's really about stepping back from the day-to-day, the nitty-gritty details of the workday and actually understanding, okay, how are our decisions, even the small decisions that we're making, really playing a role in the context of the broader organization's goals. And then finally, really thinking towards the future. So trying to be as proactive as we can in our thinking and not just reacting to the market forces that may be in front of us right now. So Gina, can you tell us a little bit about what we mean by experience of care?
Yeah, absolutely. Thanks, Riley. And, the definition itself has really evolved over the years. So I'm glad we're going to take a second to make sure we're speaking the same language here and talk about it. So, historically, when patient experience came into the conversation, we talked about patient satisfaction, customer service, almost the same thing. And I feel like we did a little bit of a disservice there as through the years we've learned that lesson because there's elements of satisfaction and customer service and experience of care, but more recent research into really what drives experience of care have really shown they're not the focus areas for patients. That's really not all they're looking for. A mint on a pillow, a resort-like experience, those are nice, but it's not the driver of their healthcare decisions. It's really much more than that. So here I'm turning to the Barrel Institute definition to help define patient experience. And if you're familiar with them, they're one of the leading organizations in this space. They've captured it well. By the way, if you celebrated Patient Experience Week last week, happy Patient Experience, a little belated to you. They sort of sponsor that and has really brought that to the conversation. But anyways, patient experience as they define it is the sum of all interactions. It's shaped by the organization's culture. It influences patient perceptions across the experience and the continuum of care, excuse me. So you can see this in the image also on the left that I've included from the AHRQ, that the elements of patient experience are truly the priorities of patients. They want all of these things. They want care coordination, they want courtesy and respect, they want communication with clinicians, just to name a few. Things like shared decision-making, culturally appropriate care, those pull the patient to the center of their experience and help to derive the patient positive experience overall as well. So I'll mention that the Barrel Institute went a little bit further to also define the human experience as well, and they've really expanded that scope here. They've said that the human experience is really grounded in the experience of patients and families at its core, but also considers the surrounding experience of the healthcare workforce. I'm talking about employees and providers, everyone involved, and the communities in which they serve. You really can't have one element successful in the long term without the other. And so we're expanding this conversation into the drivers of the employee experience, community health needs, and more. My message here is it's all interconnected, and it really does at its core relate to what patients want most in their own experience. Okay. So that evolution I just talked about, it's really also reflected in the IHI's framework for high-performing healthcare as well. This isn't new, I know. And if you're familiar with the IHI, or if you're not, I should say, they're an organization that's really widely known for using improvement science to really advance and sustain better outcomes in health and healthcare around the world. But what I love about this is the way that they've evolved and built on it over the years, similarly to how we defined that in the last slide. So starting back in 2007, they published the Triple Aim. It was their pathway for the country to follow to achieve better health overall and an improved economy. They offered these early on with 3 priorities to focus on. They said improved patient experience, and at that time, they acknowledged that included quality and safety as well, along with better outcomes and lower costs. I mean, even then, there was this understanding that quality, safety, and experience were very interconnected and really needed to coexist for successful outcomes nationally, and really around the world. In 2014, clinician well-being came into the conversation. This is when it became the quadruple aim. This is when we acknowledge you need to have an engaged and resilient workforce at that sharp edge of care if you're going to achieve the overall goals that they're striving towards. So it really brought to the forefront that we needed to stick with that plan, but add on and continue more because you couldn't have one without the other. And then most recently, in 2021, they expanded into the quintuple aim to really include health equity now as well. Understanding the need to deliver high quality healthcare to all people in the communities in which we serve really became this important addition to the conversation as well. So improving patient experience, it really has an inherent value to patients and families, and is therefore, it's an important outcome in its own right, right? But there's an ever-growing body of evidence that shows that good patient experience is also associated with important clinical processes and outcomes as well. So this is what Chris was referring to in her introductory slides today, when she talked about the clinical case really for improving patient experience. Just to kind of sum it up, she talked a little bit about some of the particular studies, but it really has been specifically shown that at both the practice and individual provider levels, patient experience can positively correlate to process of care, just for both prevention and disease management. What really sees diabetic patients, for example, demonstrate greater self-management skills and quality of life when they report positive interactions with their providers. I mean, this is likely related to trust, respect, communication, right? From there, we saw patients' experiences with care, particularly communication with providers, can correlate with adherence to medical advice and treatment plans. So this is really true among patients with chronic conditions. If you think about that strong commitment from patients to work with their providers, really being essential to achieve positive results, again, drives back towards that importance of trust and communication. And then also, patients with better care experiences often have better health outcomes. That's powerful. I mean, for example, studies have shown patients hospitalized for heart attack that after a year later, when they had more positive reports about their experience as an inpatient, they actually had better health outcomes a year after discharge. That's really powerful. And what this really led to has been shown that measures of patient experience can also help reveal important system problems, such as delays as return test results, gaps in communication, things that could really have broad implications on clinical quality, safety, and efficiency. Our patients can tell us about that. Maybe they're experiencing something that we're a little bit blind to. So when we're able to build trust and have those open communication, patient and families become active and engaged partners in their care. They truly want to help you to improve. All right. So I couldn't go on without talking a little bit about healthcare consumerism, because healthcare is personal, but it is also competitive. Patients are more engaged consumers of healthcare than ever. Long gone are those days that patients really kind of blindly going to the closest hospital or to the first consultant they receive a referral to. I mean, this makes sense. If someone needed to buy a new car, if they were going to go to a new hotel, they would certainly do their homework, evaluate all of the available options. And why would healthcare be any different? Truthfully, there's so many options to choose from. It's personal, and patients are much more engaged in this space. So just like looking for that car I mentioned, when a patient seeks services, they evaluate choices and make decisions based on factors available to them. So online resources over the years have expanded tremendously. I really only have a few examples here because patients are much more comfortable utilizing those and seeking that out. Online research comparison shopping is a real thing. Partly spurred on by the COVID time at home, but also because I think our generation is shifting to one that's much more comfortable with this level of detail in online research, really has brought this to the forefront. And a few things you're going to see here that I'm going to point out. So first and foremost, there's the Leapfrog Hospital Safety Grade, which we know provides a very consumer-friendly A to F rating. It's clear not only how you rate, but how you rate its surrounding facilities as well. It helps to support patients and families consider all of the information available to them within the details of that biannual letter grade rating. Clearly, we all want an A experience, and so patients are going to look for that and do that comparison shopping in a really simple way, starting right there. From there, we see Medicare.gov. I'm sure you're familiar with that. They offer star ratings for both quality, overall quality, I should say, and patient experience measures. We all know about 5-star ratings in everything practically today. So this is super familiar and easy to use as well. And then there's actually physician reviews available now too. These are actual patient comments and feedback from verified patients. It's a little different than a Google review or an Angie review, quite frankly. This is a little bit more about firsthand insights into why patients are rating providers in the way they do. This is where you can find out how safe they feel in their care, how coordinated their care is being delivered, how patient-centric the experience truly was. Those are the things that are really most important to patients at the end of the day. Um, that's what drives it for them. So my message at the end of all of this is, even if you're the only business in town, patients are really aware they have options now, even if they're virtual, and just they come in prepared and with expectations before you've ever met. So really being wise to that and understanding this information that's out there, how it can really, kick this off in a different manner. Okay. So before I hand this back over to Riley, and this will just in a second, I do want to add one more insight. I've mentioned patient-centered communication, patient-centered care several times already, and I've mentioned it's a key driver for the patient's experience. But what is it really? It's exactly what you see here, just so that we're on the same page. It is respectful, transparent communication of information that's inclusive of the patient's values, their preferences, their needs. It's very well coordinated care. It includes the patient in decisions being made. It ensures that communication is clear and understandable. It's providing comfort and support in a way that relieves fear and anxiety for the patients in the way that's needed in the moment, knowing that all patients are not the same. And it's really inclusive of families and friends to be supportive as well. It's understanding that every patient is an individual and meeting them where they're at. I knew someone that captured this idea really well. They used a phrase that always said, as a patient, there should be nothing about me without me. That has stuck with me all these years. And it really is the hallmark, what I think of as optimal experience of care that's a very patient-centered approach. And with that, Riley, I promise I will pass it back to you now.
Thanks, Gina.
Sure.
So, at this point, we've defined strategy. Gina's given us a great overview of, where we're coming from when we talk about experience of care. But really, why are we talking about these two together? What's the link here? And I think the link really lies in this business case for patient experience or experience of care. So from our perspective here, really, it's a threefold thing. So you have patient loyalty, positive referrals, and then ultimately that financial performance that really make up the business case for patient experience. So starting with patient loyalty here, a focus on patient experience, tends to lead to higher patient retention rates. So this makes sense, right? I go in, I have a great experience with a healthcare provider or healthcare system when I am seeking care. I'm much more likely to follow up and to continue using that provider for future episodes of care because of the experience and the quality of care I received when I went. So that really leads to positive referrals. So when I have a positive experience, I'm far more likely to recommend that provider to my family and friends when they're seeking care for whatever they may need, right? And so over time, this word of mouth, these positive referrals, they build up a reputation for the organization of positive patient experiences, and really increases an organization's likelihood to attract new patients because they have a tried and true approach to patient-centered care. They're building that reputation of delivering quality and patient satisfaction. So all of this really leads to, or can lead to, better financial performance as a result. So studies have shown that higher patient experience ratings do tend to accompany higher levels of profitability. So obviously this comes from, the excess in patient volumes due to those increased referrals and patient loyalty, but also we think about the quality of care and the quality of experience we're delivering. We're going to have, reduced costs for lower readmission rates because our quality is care. We're really focusing on providing the highest level of care, but also having a positive patient experience is going to lead to more patient satisfaction and then therefore really less any issues and financial issues with malpractice lawsuits and things like that. So really that's what we talk about when we're meeting the business case for patient experience here.
Yeah, so when it comes time for a strategic plan to be developed, it often is helpful to consider the patient experience perspective or voice, if you will. And so, just kind of to touch on a few considerations when you start to think about that link, I mentioned it already a bit, but it starts with consumerism. Patient preferences, expectations are evolving, and they're really not the same as they were before. Patients no longer come in sort of with an innate sense of trust. They no longer come in expecting things will be cookie cutter. They want to be involved. They want it to be personal. They want it to be where they're at the center of that. So it's really important to align strategies in a patient-centered way and ensure that we're meeting those preferences and expectations. I'm going to go back to that phrase I mentioned earlier, nothing about me without me, right? So definitely, as you think about your strategic plan and how you want to, organizationally move forward, make sure the patient is at the center of that. That's really important. The second piece is around staff recruitment and retention. So, your staff, they're consumers of this as well. A positive employee experience is really driven by known factors overall. It's why healthcare workers usually get into healthcare. In fact, they typically want to deliver high quality care to patients in a collaborative approach, in a very patient-centered environment. And they're going to seek out employment opportunities where they're able to do so and stay where they feel supported in that and able to really achieve that consistently. So there's pride in high quality scores as a healthcare provider. They strive for safe care delivery. That's really a moment of pride in that space. And it really can reflect in strong experience of care measures for caregivers as well. So thinking about all of that is important. If workforce is your concern, this is something to think about here in that space. And then, of course, the third is integrating initiatives. So as I mentioned, it is all connected. In the past, patient experience was kind of a separate consideration. It was something we held to the side when there was time to address it, when it was, thought of as a nicety or an add-on. It might have been a separate pillar, a strategic plan element in the past. But the secret is it's really integrated into everything else that you're doing, rather than as a standalone initiative of convenience. Patient-centered care really needs to be embedded into the elements of your plan if you want to ensure that you're addressing the things that are most important to your patients, also to your employees, and really garner long-term success and optimal outcomes.
Yeah, so Gina talked about some of those patient experience considerations for strategy professionals, and some of this you're going to see is some overlap. But I wanted to touch on what are some strategy considerations for those that may be operating more in the patient experience space. And so I think it all boils down to this phrase I've been thinking about: consider your impact, right? So really three considerations here are implications on reimbursement, the cultural impact, and then to piggyback off what Gina was saying, really that workforce consideration. So talking about reimbursement first, we all know that insurers these days are really trying to tie these patient satisfaction metrics and quality metrics to reimbursement, right? So considering the impact, as a patient experience professional that you have on, the positive performance of the organization through this. But also it's considering that how can you contribute to that positive performance in the form of driving patient experience, patient retention and patient loyalty, like we talked about earlier. So considering the impact that, you as a patient experience professional may have on the broader organization's performance at large. There's also a cultural impact piece here. So I'm willing to bet on the call that we have, a large number of professionals from all different areas of the organization, from different backgrounds. And you all probably have a long laundry list of things that you have to take care of every day. And so it may feel sometimes like patient experience measures may be an additive to that list, right? This is really where patient experience leaders get to shine. A lot of the times the onus is on them to make sure that patient experience isn't really a line item on a plan or something that gets put on the back burner, but rather the opportunity lies in how do we bake patient experience in a patient-centered approach into everything that we do, right? So a lot of times that's going to fall on patient experience leaders to take the first steps in that. And then I know Gina talked about workforce considerations, but I can't stress this enough, right? Why do people get into healthcare at their core? There's a calling to it, right? People want to take care of people. They want to deliver the highest quality of care for every patient that walks in the door, right? And so creating an environment that values this and drives this forward is really important when we think about keeping our good people and attracting top talent. I don't think, just from a strategic planning perspective, that we've done a strategic plan in the last, 2 to 3 years that hasn't included some form of workforce consideration, right? So this is super important as we think about how we're going to drive our strategy over the next 3 years. And there's an opportunity to really bring that patient-centered approach to the forefront. So we've talked about the link between patient experience and strategy, but what does this look like in practice to start to bring the two disciplines together as we go into strategic planning, right? And so really one of the first places to start that Gina and I have found is really looking at data to help us make patient-centered strategic decisions. So data plays a huge role in helping uncover the opportunities that an organization has within a patient-centered space, right? So it helps us identify patient preferences and what they're really expecting from us as a healthcare organization. It helps us understand what are the gaps that we currently have in care that we deliver, and where are some opportunities for greater efficiencies so we can make sure that we're delivering the highest quality patient experience. Now, I'm lucky to be joined by Gina, who is far and away the expert here on exactly what types of data that we can gather in this patient experience space. So, Gina, do you want to walk us through, what this looks like in practice and what are the types of data that we can get from this type of space?
Yeah, absolutely. And I joke that, believe it or not, I'm actually a data person. I love the importance that you always place on data as part of the strategic plan. I love that. Thank you. And we all know the importance of data and quality and safety. It's where you need to go with knowing you've made a change and made improvement at the end of the day. And truthfully, the same goes when it comes to patient experience. It can just be a little bit more difficult sometimes to capture at times. It just isn't as black and white often. Patient experience information is not generally something that you can look in a chart review, for example. You can't audit and see if the patient was communicated with in a patient-centered way, how they perceived the care being delivered to them, if they felt as though things were well coordinated. It really requires that there be an engaged population of patients that are willing to share their voices with you for improvement planning through whatever avenues are available to them. And you want to make sure that you're using the right data to make these decisions. So, first off, kind of the patient survey data. This is generally our gold standard. People look to this as the way to start. It's the official survey your vendor has given to a patient to have them evaluate various elements of their experience with you. And it's not just inpatient, right? It can be without the continuum of care. This is often where we start, but it isn't really where we need to end. I'll say that. It does provide benchmarking for comparison. It provides an easy way to capture some voices. This is what's used in reporting for many programs. Riley mentioned, I mentioned Hospital Compare, for example, but Riley mentioned things more along the lines of value-based purchasing, other financial programs that help to, incorporate these measures, if you will. So certainly this is what's used in all of this, but honestly, it might not be enough. If you're a small and rural area, if you're a facility that has low volume, if you don't have a high response rate, for example, you might have to look outside of that standard survey box to get a little more feedback to make the right decisions about your strategic plan. The second thing we have listed here is Net Promoter Score. So Net Promoter Score is actually a little bit unique in patient experience, but it's certainly having a growing presence. I shouldn't say unique. I would say newer to the party, if you will. But it's frequently in other industries and businesses. So, organizations that are looking to evaluate market share are very familiar with this. And we're going to start seeing this more in patient experience, certainly. But it is still based on patient voices, which is good and can be helpful. We can look at those patterns that exist within your promoters. What is getting them to promote you, but it also where are your opportunities with your detractors. What does that look like from consistency? And kind of it speaks to that business case through the voices of your patients. So we're seeing that more and more. It's coming through and something to consider, particularly if that's something that your organization prioritizes. The third one we have listed here is employee and clinician survey. So we talked a bit about this before. What drives employee experience certainly connects with what drives patient experience. Caregivers want to deliver safe, high quality, patient-centered care generally, it's usually connected to what got them into healthcare, as Riley has mentioned as well. So it's really critical to evaluate and understand those measures as well. You have to ask, you have to evaluate, you have to do something to improve, to support those and engage the hearts and minds of those that are really at that sharp edge of care we talked about. And then last, though, we have qualitative data from on-site assessments. If you, like me, are a fan of Lean and Six Sigma, and then you know you really need to do that Gemba walk, you need to go and see, you need to get the insights that are available in real time. It helps to be immersed in the environment to gauge a true evaluation of your culture. This can help to inform your strategy in a more patient-centered way. It really helps you to see things from their perspective, not just sort of reading them off the page, if you will. It really helps to demonstrate visibility as well in this space for you, particularly if you're a leader. We're going to touch on that later in this presentation, but I can't really minimize the importance of all of that as well.
And so when we talk about really integrating these two processes, I wanted to give a quick overview of, our approach to strategic planning here at Ovation, and then where we've been able to find some opportunity for overlap and collaboration with Gina and the work that she does in the patient experience realm. So just a quick overview of our planning process. Really, we break it down into 4 main phases, right? So we have the kickoff and information gathering. This is where we determine the scope of the project. We outline, the timeline for how we're going to make sure that we're completing the plan and gathering all that initial data for review and for analysis, right? So that leads us into the actual data analysis and discovery phase. So this is where, me and my team, we spend a lot of time combing through all the data, performing a variety of different analysis to ultimately discover what are some of the key insights that we need to find throughout the analysis phase to really support the the creation of the plan and starting to form those priorities. So from that point, that's when we get into really the visioning phase, and where we start to form those priorities along with the board and the senior leadership team, trying to understand where are we trying to go over the next 3 to 5 years. And so throughout that process, we'll kind of create what we like to call it a strategy on a page that can be socialized throughout the organization, and then we'll develop that full plan ultimately for that board review and approval, right? So when we think about how we can link the strategic planning process, with patient experience, where we found the most overlap is in these 2 phases here, the data analysis and discovery phase, and then ultimately that collaborative visioning and forming priorities phase. So just as me and my team, in the data analysis phase, we're spending some time going through all the data, trying to understand what it's telling us. Gina's doing this alongside us, right? So she's trying to gather insights to really start to understand how we can form the best patient-centered approach. And then when we get to the phase where we're forming those priorities, we can start to develop the plan in a really collaborative way. So Gina talked a little bit earlier about not having patient experience being a nice to have on a plan or just being a single line item. This is where we start to move towards really having our entire strategy as an organization be patient-centered, because we're starting with the groundwork of marrying the 2 data analysis phases and really collaborating on what those priorities should be. And Gina, do you want to tell us a little bit more just about your process here and how that fits into the strategic planning?
Yeah, absolutely. As Riley mentioned, we really found that those original elements of the patient experience assessment just complemented and integrated into the strategic planning process that his team was leading absolutely seamlessly, which I think was a bit of an aha moment, but also really helped to drive this forward a bit. So just kind of to touch on this in a bit more detail, at the center, what you'll see here is that data review and analysis. And, as Riley mentioned, as we talked a few slides back as well, this really can provide insights into your current state, your strengths to leverage, your opportunities to prioritize moving forward, but how connected this really is to the larger elements of culture. This can be done in collaboration with that strategic team's approach for efficiencies and integration. So we don't need to be asking these same questions twice. We can be doing this together in a way in which helps to really pull this together for the larger conversation. Seeing that big picture helps with the overall strategic plan is really patient-centered from the start. Now from there to the left, you're going to see we have leadership interviews and focus group sessions. We're doing oftentimes a pre-meet survey with leaders to kind of help hone in on the key areas of focus and identify opportunities. It really allowed us to customize our conversations and drill into the details of specific needs. And the end goal was really to gather as many voices as possible to better understand the full picture of experience of care. So we took this approach not just for leaders, though, and say we talked about patients, we talked about workforce, the communities in which you serve. The more we could gather those voices and really pull together the big picture, really helped to it's really helped to elevate the patient-centered aptitude at this place and time. Yeah. And then last but not least, to the right, we talked about on-site observations and identified best practices to really help with that culture assessment. And I mentioned this a bit before, but there's really nothing better than going to see to gain the perspective on experience of care within your organization. What are those best practices that you expect to be in place? How consistent and reliable are they being delivered? What's the ongoing culture for patient and employees and providers and the community? How do they all intersect? It's lots to learn by being present in the moment there, and really how that all intersects and interconnects makes a big difference. So it really does help to inform this strategy to kind of go and see and really be a part of that.
And so what's the result of this collaboration, right? So we have a couple key outputs from, my work with Gina and how we've been able to marry these two processes together. So the first of these outputs is really kind of more on that data-centric side, right? So typically, we'd be at a strategic planning session, at a retreat setting, something like that. Where my team, obviously, we would present all the data and the insights that we gathered, but Gina would also be doing that alongside us as well. So you can see we have an example of a leadership assessment tool that Gina performed, and she was able to present, the findings from that, as well as her findings from the overall patient experience assessment that she performed. She's able to present that at the strategic planning retreat. So already just ingraining those processes into the process of strategic planning. But really here, I wanted to focus on these two frames on the right here. So I'm sure most of you on the call are familiar with a SWOT analysis, right? That helps us understand, what are the strengths and weaknesses, opportunities, threats that are going to inform those strategic priorities. Well, you can see here that we created this SWOT analysis collaboratively, right? So you can see the highlighted pieces. Those are going to be where really patient-centered line items that Gina and we found that really go together on that spot. And then all of those inputs above really land into the strategic plan or strategic framework here. So like I talked about earlier, not having a patient experience or a patient-centered culture be a part of the plan, really what we were left here is a plan that is completely ingrained with patient experience measures throughout, because we started from a collaborative process. So really co-developing that patient-centered approach and tactics landed to a plan that truly is patient-centered, which is the main goal here.
Yeah, absolutely. And so I think we're going to dive in just to kind of round this out a little bit, is to talk about the leadership's role in a patient-centered culture. Excuse me. I have to say, instilling a patient-centered culture, inspiring change in general can be hard. It takes a strong and dedicated leader to drive success in this space if this is new or this is unique, if this is a big shift from where you've been before. So, as leaders, you can foster that culture. Your role is pivotal in garnering success, not only for the immediate planning process, but for the long term as well. So, how does that work? Well, first off, you set the tone. Demonstrating executive visibility on this is critical. Go first. Walk the talk, help others to connect the dots, be patient-centered in every conversation, help to demonstrate the priority that this has become, and consistently sustain that. It's not just for today, it's the way moving forward. Absolutely. Secondly, engaging with patient experience data. Now, I mentioned this can be a little bit different than what you're used to when you look at other elements of data. It is a little less black and white sometimes, but don't shy away from that, right? Don't write off low volume as meaningless data. Sometimes people say, oh, we don't have enough, it's not worth anything. That's not quite true. Digging deeper to gather qualitative and quantitative data that's available to you is important. Knowing that every voice is a patient receiving care or is an employee that is delivering care, and understanding how that can have an impact is really important. Patient-centered care requires you capture voices and use that information to improve. So ensuring your do so is critical. And then third is supporting clinicians and frontline staff. It's a journey. It's not just a singular point in time. It might take time and tools and resources to get you there, particularly if this is very new. You need to support that to ensure it crosses over to every area of the organization and it sustains for the long term. This is going to avoid that flavor of the month mentality. It's going to help to drive home the importance of consistency and reliable experiences for all.
All right, so we're coming up on the end of our presentation here, but wanted to leave you all with just a few key takeaways from our presentation today. So the first of which is just ensuring that, any and all patient experience initiatives, they align with the overall strategic direction of the organization. And, you can find a lot of success with that through what me and Gina talked about, really starting from that collaborative place so you can ensure that you're aligning those two together. One way that you can really do that is by actively engaging with the data that you have available in this space, right? So trying to understand what opportunities are the data telling you that you can really lean into from a patient experience and patient satisfaction perspective, and how can that inform some of the strategic initiatives that start to make their way into that plan. And then finally, it's just continuing to promote leadership's role in championing this experience of care programming, right? So like Gina talked about, setting the tone, engaging with the data, and really supporting the clinicians and the frontline staff, equipping them with the tools they need to be successful in this space to make sure that they're continuing in everything they do to keep that patient-centered approach. So that's really all we had today in terms of the presentation. Well, thank you guys for listening. I think we have a bit of time for questions. So Chris, I'll turn it over to you.
All right. And Gina and Riley, thanks so much for the great content, and looking forward to some questions here and some conversations. So we're going to start off. So we've got quite a few questions, so please keep them coming in, and we'll answer as many as what we can here while we're still on the webinar. So the first question, Gina, I'm going to kick this one to you. And can you please answer, how do these patient experience strategies relate to the hospital HCAHPS score?
Yeah, that is a great question. So, I think we're all familiar with HCAHPS. HCAHPS is the inpatient question or survey set, I should say, that CMS has put out there. And they are very specific to elements of the experience of care. And actually, on one of the early slides, I showed you that AHRQ diagram and kind of elements in a circle of the patient experience that were important. I mention that because actually those questions were really designed around much of this, around patient centricity, around having a very patient-centered and focused experience of care. So when you think about HCAHPS questions, or quite frankly, any of the CAHPS questions, surveys, so whether you're inpatient, outpatient, ambulatory surgery, any of those, there's lots of questions around communication. Communication with nurses, providers. They specifically reference courtesy and respect. They ask the patient to evaluate how consistently we did that. They ask about communication in a way that you could understand. So are we connecting with patients and communicating in a way that helps them understand? Are we including them in the conversations and really helping to educate them in that space? Are we listening carefully to them? That's an important element overall. So actually, it's hand in hand, if you will. As we talked about being very patient-centered in your approach and then building that into your strategic plan, it is very much looking to a positive HCAHPS outcome for sure. Great question.
All right. Thank you, Gina. And Riley, I'm going to kick this one over to you about, where would you recommend that I focus first to integrate patient experience into our plan?
Good question. So I think we recognize that for many organizations, this will be new, right? Trying to incorporate these two disciplines together. So I think we want to start by realizing we don't want to reinvent the wheel here or, make it harder than it needs to be. So when I think about where do I start, where do we start to really incorporate these two processes together? I think it's that data piece, right? I think it's utilizing and engaging with experience of care data and marrying that with some of the data that you've analyzed and gathered from the strategic planning process, and trying to understand where the insights that you can really capitalize and where some of the opportunities to really weave that patient-centered approach into your strategic plan. So yeah, I think starting with the data, makes it a little bit easier and not such a reinvent the wheel process, but rather utilizing what's already at your fingertips in a new way.
Great. Thank you, Riley. Gina, I'm going to kick this one over to you. And there's a couple of questions that are related, so I'm going to try to put them together for you. Are there specific examples of being supportive to frontline staff that appear to need improvements concerning patient-centered care? And then also, part two of that, how do you involve families and caregivers into patient-centered approach?
Oh, yeah, good questions. I think to the first question around frontline staff, it starts with sort of understanding. So, I think Riley, you just mentioned this, the importance of data. So understanding from their perspective what that looks like, and understanding where they feel disconnected in that space to be able to, are they not supported? Do they not have the tools? Do they not have the resources? Is it a time thing? Is it I don't understand how? Is an opportunity kind of open up in there? So, from a frontline staff perspective, it's gather some information, understand really what that looks like. Do they not feel like they're part of a team? Do they not feel like they're communicated with well? And then you customize that strategy really, because boy, there's a wide range of things that could be leading to that. So, and we've worked with lots of organizations that experience that and helping to study, so, okay, let's look at your data and kind of go from there, or let's look what you're hearing. If it isn't a survey, right? And this is back to my point of find the data where it's at, or find the voices where they're at and go forward with that. So, certainly we have lots of examples of ways we've done that. If there's something specific, I'm happy to connect with this person afterwards and understand a little bit more what that might look like. But yeah, really think, what's your source, what's your strategy, and go from there. And to the second question you had there is involving families and caregivers. That's really opening the conversation, right? So how inclusive are we in that? Building trust and building communication and conversation really is led by clear communication. It's really ensuring that we are inviting people into that conversation. Are we having, for example, rounds with at a time when patients and family members, family and visitors can be there if appropriate and if the patient approves, to be part of that conversation so that they're with them? Are we putting them at the center of this a little bit as well? And sometimes that's tough for us because it's out of our standard, or it's maybe not what we usually do, but understanding to customize and really shift forward in that place so that we can include them in that is really important, because we know the connection to the outpatient side. So once they're out of our care and they're kind of into we're going to rely on their family members and their friends and others to be involved with this and really be inclusive of this. So finding ways to do that is really powerful as well. So yeah, I hope that answers your question.
Thank you. And there's a few more I want to try to get to too. And I'm going to take this next one, and it really talks about how can we better advocate for individuals who have faced some adverse outcomes. And I think we've talked a little bit about this. When we think about what's the leadership commitment to patient safety? Is it one of the strategic priorities? What's the organization's culture of safety? And do we see that throughout? There are many organizations, as you know, that are doing culture of safety surveys. They're also doing employee engagement surveys. And we can take a lot from those surveys and put some action plans into practice. So I think that's something that we should be mindful of. Of course, there's other things when we think about how do we get our data, and Gina talked a little bit about that. How do we get our data? How do we use that data for improvement? And when we think about, that the science behind that and how do we put that into our practice, obviously other things like education and training, the patient and family involvement obviously is huge. Gina just talked about that. And then I think that the communication, the transparency. And, as you know, we are required, and it does vary by state for some of the safety authorities, but, we are required to have structures and processes in place to address patient concerns and adverse outcomes and so forth. So couple of more questions. I think we have a few more minutes. This one is about what is the process you follow to identify the leading or process indicators that will impact different HCAHPS domains? And can you provide some actual examples? So I'm going to tap into Gina, and I'm going to read that one more time. What is the process you follow to identify the leading or process indicators that will impact the different HCAHPS domains?
Oh, that's a good question. So if I'm understanding that, we're kind of getting and thinking, taking an HCAHPS measure as an outcome, what's your process to get the outcome that you're looking for? So, it's a couple things. First off, certainly there's some data science behind the measures that you're looking at. If you are fortunate and you have a large volume of survey returns and you're able to work, whether it be with your vendor or internally, to kind of aggregate and segment that data to really look for individual source, that can help to identify opportunities. I mentioned earlier about known drivers of loyalty, and I mentioned earlier about what we know connects to the larger patient center's experience of care. But if you have the benefit of a lot of data that you can start segmenting and breaking down to find your source, that's going to be helpful in identifying where you want to, what bite of the elephant you want to take first, if you will. I'm trying to think of a good example to give you here. Okay, I'll just kind of off the top of my head give you an example. If we know that, so we talked about communication is a challenge, particularly if the listen carefully, courtesy and respect, explaining in a way I can understand. But I want to kind of tie into a question that someone asked earlier as well about the family and engaging them in it as well. It can come down to something as simple as, how are we involving those people in that conversation? So if you're segmenting your data and you're seeing that, whether it be in the data or whether it being in the comments, whatever the case may be, is there an opportunity to implement a new best practice or create a culture in which we are more inclusive of that? So what I mean by that is, a great example is maybe multidisciplinary rounds. Is it something that we're doing that we are having at the bedside with the patient and the family conversation about a plan of care, knowing that it's going to get us to the outcomes that we're looking for, because that was the source of that concern? I hope that answered that question for you. If not, I hope you reach out. I'd love to have a more conversation about that and go a little more detail if there's a particular measure that you want to drive towards, because I think that can be helpful if you're thinking about how you're using the data to find your source and then moving forward in your planning about improvement process.
Okay, and I think we have time for just one more question. We have 1 minute left. So going to go to, you talked about how hospital executives can influence and support experience of care across the organization. Can you speak a little on how other leaders can contribute as well? So Riley, can I tap you for that one, please?
Yeah, I've been thinking about this a lot, and I think it's very simple. It's, thinking about your sphere of influence, right? And so whatever whatever area of the organization you may operate in, whether you run a department of 100 people, whether you run a department of 5 people, I think one place to start is really taking a step back and asking, how are we being patient-centered in this decision? How are we being patient-centered in that decision? So sure, you may not come from top level, executive leadership, the way that you set this tone may look different, but in your sphere of influence, just asking that question, I think, goes a long way in starting to ingrain a patient-centered culture, putting patients first throughout any of the, the departments that you run or the spheres that you operate in.
Thank you. And with that, we are back at the top of the hour. So want to thank everyone for joining. Want to thank our colleagues at Leapfrog as well for allowing us to host. And have a great day, everyone. And we appreciate you being here. Thank you. And thank you, Gina and Riley.
Thanks, everyone.
Thanks everyone for joining.